Hello, and welcome to Common Health, a podcast brought to you by the Virginia Community Healthcare Association, where we discuss all things community health in the Commonwealth of Virginia, amplifying the voices of those who are served by our community health centers and those who serve them. I'm Adrienne Harden, a registered dietitian nutritionist for Virginia's community health centers. I am your guest host for today's episode, which is focused on a wonderful program called Reach Out and Read. I am pleased to introduce today's guest, Callee Boulware, Regional Director for Reach Out and Read for the Carolinas, Virginia, and Washington, D.C. Callee received her Master's in Business Administration from the Moore School of Business at the University of South Carolina and is deeply committed to making Reach Out and Read a strong, sustainable reality for all children across the Carolinas. Callee is also a member of Leadership North Carolina Class of 2024 and an advisory board member of Capita. Callee, welcome. Thank you so much for being here today.
Oh, thank you so much. I'm very excited to be with y'all and for our conversation.
I am very excited to have you today. I watched the recent webinar on Reach Out and Read that you did for our members as well, and it is so clear that you have a tremendous passion for your work.
Thank you. Thank you. I do love what I get to wake up and do every day. It's wonderful.
And we can tell. So please tell us, how did you come into this organization?
Sure. Well, I love this story because it started a long time ago when I was in college at the University of South Carolina. I was a part of a student-led organization called Dance Marathon. And it is a student-led philanthropy that raises money for Children's Miracle Network and for local children's hospitals. So through that role as a college student, I became exposed to the amazing world of nonprofit work and the world of really that larger healthcare sector. And I knew immediately in my work with those children's hospital staff members that supported us as students, that's the kind of thing I wanted to do. So when I finished undergraduate school and graduate school, I circled back with some of those amazing contacts that I met through that experience with Dance Marathon. And I said, okay, I want to do what you do. I want to work to help children and families be healthier and thrive in communities. And at that time, Reach Out and Read lived within the Children's Hospital. Reach Out and Read is a provider-led organization, and some pediatricians from that Children's Hospital brought Reach Out and Read to South Carolina. And there was an opportunity for me to start doing work with Reach Out and Read through that Children's Hospital connection after graduate school. And that is where it all started, and the rest is history.
Love that. And how cool is it that it started with Dance Marathon? I would have never connected the two.
I know. It was a transformational moment for me as an individual. And it was something that still to this day, dance marathons across college campuses across the U.S. are doing a tremendous amount of fundraising for lots of great initiatives, including children's hospitals and some Reach Out and Read.
That's exciting. Thank you for sharing that with us.
Yeah, sure.
And I love that you gave a little bit of the background, but can you just tell us more specifically about Reach Out and Read as an organization?
Yeah, absolutely. So I think simply stated, at its heart, Reach Out and Read is a public health intervention. We see ourselves as really a tier 1 public health intervention that really supports both clinicians and families during that really unique touch point of the primary care visit. In those early years of life, children go to the doctor a lot. In those first 5 years, which is the age range for Reach Out and Read, families are in the doctor's office 14, 15 times. And so at each of these touch points, the Reach Out and Read intervention is embedded into just the way that they are cared for by the clinicians in those practices. And what we know that Reach Out and Read does is that it creates meaningful impacts for children and families, meaningful impacts for providers, and really what we might call practice change for the clinical settings in which we're partnered. But I think the best way to tell you who Reach Out and Read is to kind of just paint a picture in your mind of what it might look like. So for many of you, you remember these well visits, or maybe you're living in that moment right now. But when a baby, let's say a 6-month-old baby is coming in for her checkup, and her parent or caregiver are in the room with her, and she's sitting there waiting for the provider to come in. When that provider comes into the exam room, they have a book in their hand, and they have selected a beautiful age and language appropriate book, developmentally appropriate appropriate book for that baby. And they walk in the exam room and they're going to say hello to everybody and they're going to hand her that book. And she's going to grab it with her chubby little fingers and she's going to put it right in her mouth and she's going to chew on it. And the provider is going to then use that opportunity to launch into a really critical conversation with the adults in the room. And the provider is going to say, look at her, she's so smart. This is exactly what 6-month-olds do with books. They chew on their world. This is developmentally what's happening, in their brains and with their bodies. And this is just how she should be enjoying and exploring this book. And so then we get into what we call sort of the coaching part of the reach out and read model. And that provider is going to launch into a discussion with the parents in the room a little bit about developmentally what's happening with their baby, what they're looking to see in her development at that time, and also how to make sharing books and stories an important part of your daily routine and their everyday lives as a family. So all of that is happening. And the thing that's so beautiful about that model is that it's providing support and guidance to the parents and the caregivers in the room. At the same time, it is allowing that provider to do some of what they need to do to really get a natural lens into how does that family spend time together. I can watch how that baby's maybe manipulating the book. If I hand a child a book upside down at the appropriate age, can they orient the book? How about turning the pages at the right age? How about pointing at a color or a letter or a number? So it becomes a really critical part of the provider's developmental surveillance of the child as well. So I like to say that it's a great tool for the family and it's a really critical tool for the provider also. So that exam room interaction is happening, and then the family takes home that book with them so that they have in their hands and in their homes the tool that is needed to implement that prescription to read every day that they have been given. So the model is simple, the model is effective and research-based, and the model has a tremendous amount of benefit to both provider and to family. So that is what Reach Out and Read kind of looks like at every checkup between birth and 5 years old. And so it's our goal to really partner with all medical practices that take care of kids in those first years of life.
Wow, what an amazing and comprehensive explanation for us. And that paints a beautiful picture, like you said. Picture coming into that visit, picture what the child is doing with that book. And you kept mentioning the model. I love how something as simple as reading with your children and having a book provided from a doctor or physician in a well visit can come with so many benefits and that it's peer-reviewed evidence to support it. So
Absolutely.
You were talking about this evidence-based model. Can you flesh that out for us a little more?
Yeah, absolutely. Absolutely. Well, I'd like to, I'll start with a little bit of I think it's a really cool origin story for where our model came from. And as an organization, we work really hard to make sure that we're centering our work and centering ourselves in the communities in which we live and which we operate, right? So the Reach Out and Read model itself is a great example of how this happened. So our founders were providers. They are providers, but they were practicing in Boston in the time and, sort of began to explore what would happen if I brought books in this visit with me? How would this change the conversation? How might this change the interaction? How would the children react? What would that be like? And so our founders started bringing books into their well visits, and they saw just miraculous things happening between the children and families, between the parents and the caregivers and the provider, and the excitement and the joy in the children's faces told them everything they needed to know. So because we do exist in a medical space and our providers are the ones doing this work, we all know doctors love to do some research. So a tremendous amount of research has been done on Reach Out and Read over the last 35 plus years of our lives and of the history of that model and how it's implemented. So the research shows a lot of things. I'll hit just a few buckets of highlight, and that'll talk a little bit as to sort of, I think, why Reach Out and Read has grown to the scale that it has. In that research, we've seen really tremendous changes and outcomes for children. So here's where we're looking at things like expressive and receptive language scores, sort of readiness to thrive upon school entry, all those things that we want to see children demonstrating to show that they're kind of ready for the next journey in their lives after those early years. So great outcomes for kids. We also see really tremendous changes in behavior for parents and caregivers. And as an adult and as a parent, I can tell you it's real hard to change the way I do things. So it's really fantastic. And our providers, to be honest, are so excited by the research that keeps growing all the time to show how the advice and the support that they are giving families during that well visit, it is changing the way families spend time together at home. It is creating more of those moments in the lives of children and families than before. And that feels really, really amazing for our providers as well. And then, of course, we know all the great things that happen when those positive sort of bonding, snuggled up moments happen. It's great for kids. It's also great for the adults in the family. So it really supports the whole family unit in a way that we want to see. And then we also see some really phenomenal results related to clinical environments, related to things like provider resilience and sort of mitigation of provider burnout. We see the relationship that families feel and interpret between provider and family, how they feel valued and really, seen as a part of those clinic settings. And so there's some really wonderful things for everybody involved. And I've been doing this a long time. I've been with Reach Out and Read 24 years. And the number one question I have received, no other question is close, is providers are too busy. I don't believe you can get them to do one more thing during that well visit. I don't believe you can do it. And I think the research that we have is part of the reason why we have a significant waiting list pretty much everywhere in the country for providers who want to do this. They want the benefit for them and for their families and for their practices. And they've maybe been taught Reach Out and Read in residency. And, it's a valued part of who they are as a provider and how they want to care for families.
Amazing. So there's a few things I want to touch on that you mentioned. Yeah. One, you mentioned several benefits across the board. You talked about some of the benefits for parents and caregivers for reading with their children. And I know we can talk more about those benefits as well. And then you also mentioned the benefits for the providers and what they're able to accomplish in that visit. Yeah. Then you talked about that the research and even with providers being so busy, addressing that and how that kind of, how do you get providers to do one more thing? I think that's a great question that comes up because I was thinking as well, how do you help them see that the research shows how effective this is?
Right.
And it sounds like you've gotten such positive feedback from the providers themselves as well as the families all around.
Oh, absolutely. You are exactly right. And I think there's a couple of main reasons for that. Number one, you heard me mention experience in residency. Reach Out and Read works pretty comprehensively with pediatric and family medicine residency programs, nurse practitioner training programs, all of those sort of training programs for the next generation of providers. We work with all of those programs to really help ensure that the Reach Out and Read approach to well care is something that they learn when they're learning how to take care of families. And then once you learn to do it that way, you don't really want to do it another way. So sort of, planting those seeds early and training that next generation of providers to care for families with that relationship at the center is a really important part of sort of that acceptance and willingness to do this in the provider network. Number two, they see the benefits, as you mentioned. And then number three, and I think this is a really important thing to note, there are realities around the healthcare industry and how much time you can actually spend in a well visit. If Reach Out and Read required 20 extra minutes, it doesn't matter how much a doctor wanted to do it, they couldn't. So the beauty of the Reach Out and Read model and the training that providers take, we have a CME training that all providers are required to take to be a part. And it really walks folks through how to do Reach Out and Read at every well visit between birth and 5. And the integration of that in the way that the training supports does not really add time to that well visit. And what our providers tell us is, as we get back to that developmental surveillance idea, there's a lot that I have to look at, observe, see, or notice in a well visit. And sometimes it can feel a little bit like a checklist. So when I can use Reach Out and Read to have a real interaction and a conversation with a family, I can observe a lot of things about them, their relationship, their child's development. I can observe those things. And then that answers a lot of the questions that I have to answer, maybe that are in that electronic medical record that I've got to go through and do. do. So it's a strategy to accomplish a lot of the things that are already present in that well visit. And it's just a different way of doing it, not something that adds substantial time.
And thank you for bringing up that CME training as well.
Yeah.
I was wondering how not only do providers get trained on Reach Out and Read, which you answered that beautifully, but also how do those providers also share the advantages of clinicians bringing reading interventions into the primary care setting? How do they share that either with their health centers, or how do you do that? And how do we get that out to the patients?
Yeah, that's a great question. I like to say when you decide to partner with Reach Out and Read, you get two unbelievable things. You get Reach Out and Read, the model that we've been talking about in that exam room, and you also get Reach Out and Read, the organization. And that is the people behind the Reach Out and Read model that are here to walk with all of our providers and all of our clinical partners step by step. So we have a team of people all across the country that work with all of the partners, the healthcare settings that are implementing Reach Out and Read. And we stand right with you, not just in the beginning to get going, but along the journey. It's one of the most, in my 24 years of doing this and learning about this landscape, it's one of the things that is the most unique about Reach Out and Read. We are here with you as implementation partners along this journey. So for providers who are really excited about the work that they're doing and they want to either take a deeper dive into research with us, if they want to work with us on MOC4 projects, if they want to work with colleagues across the country who may be doing similarly structured things, if they want to become a leader in the Reach Out and Read network, we are here with you as partners to do that all along the way. So providers not only get the model, but they get all of that back-end support of the Reach Out and Read organization to be their partners and help them walk with us along whatever Reach Out and Read journey they might decide they'd like to take.
Love it. I love that there's so much support built into the model as well. Yeah. Can you tell us more about how Reach Out and Read does fight that growing issue of provider burnout?
Yeah. I mean, there's a lot of stressors. It's the parallel that I like to use is I think about it as some of the social drivers. There's lots of things that families come into the exam room facing as challenges in their lives. Some of them providers can do something about in the exam room, and some of them they cannot. Similarly, there are challenges going on in the healthcare landscape that Reach Out and Read can sort of help to mitigate or support or build resilience around in certain ways, and others we cannot do anything about. But I'm going to go back to that word resilience. What we can do for our providers, just like we can do for families, and that other analogy is to create those positive experiences that help to buffer. And what I hear a lot from our providers is implementing Reach Out and Read not only has all the benefits that we've already discussed, but it keeps me connected with why I went into this in the first place. Why did I go into medicine? Why do I want to care for families? Why do I want to do this super important and often super difficult work? And it puts them in an interpersonal connection with families in a way that helps to build those positive moments and kind of buffer against some of those other stressors. Now, though, again, like I said, I've been doing this a lot of years, and what keeps me every day feeling like I want to keep doing this and do more of it all the time, I think it's a realization, and I think this is something that I think our providers feel with me. There's a lot unintentionally in our systems that focus on the deficits of families and community. It is well-intended. It is, sometimes we have to talk about deficits, but there's a lot of focus on the things that families don't have or that they cannot do. And it is very, very powerful to feel like Reach Out and Read brings something into the exam room that is something families can do, that it is something all families can do. It's something that providers can give them as a positive asset in their basket. And I love the idea that our providers get to tell families every day who don't hear this from many places, you are what your child needs more than anything else. You are enough. Your voice, your attention, your time, that is what your baby needs. There's no gimmick that can do that. There's no app that can do that. There's no tool or technology that can do that in your place. And a lot of families don't hear that much. and they might feel like some of their deficits are barriers for their kids. And our doctors instead get to tell families, nope, you are what they need. They're your voice and your attention. So in the same way, our providers are able to share that wonderful sort of strengths orientation with families. I think that feels really powerful to our providers as well. And it gives them something to kind of fuel their own tanks and keep this important work going.
I think you hit the nail on the head. I just thought about the level of empowerment that families must feel and that even the providers feel when you say, no, this is something that is within your control and within your scope and something that you can do. And that can do mindset can fuel someone who may have felt defeated by their circumstances.
Absolutely.
And what you just described is a beautiful segue into something that I wanted to ask you about. During your webinar, you shared that literacy strongly predicts adult health status. And you even mentioned the statistics of how it's more powerful than race, education, or income. Can you tell us more about that?
Yeah, it's a when I first read this statistic many years ago, I was a little shocked, to be honest. It was something that really gave me pause and made me stop and think. And I think the way that I have gotten my head around this and the way that it's been explained to me by folks who live in this research world is that 80% of the health outcomes, the adult health outcomes that we have, they're related to social drivers. They are not related to our physical bodies, right? Or our DNA, perhaps, how we came into this world. Only 20% of our adult health status is related to our physical bodies. And that to me is, it's shocking and it's hard to hear on one level. But on the other side, I feel like, well, then that means there's something we can do about this 80% of our adult health outcomes. That means that there's something we can change. I cannot change your genetics, but I can do something about what we're building preventatively into children's lives and into the lives of families from the very earliest days that will have outcomes that these young children will experience and still be benefiting from as much, much, much older adults. And to me, that feels so powerful that we can do that. And to know that literacy and time spent snuggled up with a book with somebody who loves you can yield adult health outcomes. There's not much that gives us a better ROI than that kind of work. So as a parent, it feels amazing for me to remember snuggling up with my own babies and sharing stories. And I think about what that meant for me as a mother, but then also to think what that means that maybe my children will benefit from as adults, not just in their educational life or in their ability to build and thrive in relationships, but in their health outcomes as adults. It's amazing. And so I feel like that's where Reach Out and Read offers a phenomenal public health opportunity to truly scale and make sure that across our entire country, this is how we care for families and make sure that these moments snuggled up with books and stories that have this kind of ROI is a part of how all children and families are supported.
Great. And even encouraging more families not to take for granted how something that could seem like a simple intervention can have lifelong impact and wonderful health outcomes. So I love that you describe both of those beautifully, the simplicity of it, the empowerment aspect, and even the joy that comes with it. But then we see the research and the actual evidence that support it. Well,
100%.
Well done.
100%. I mean, I'll tell you, the image I use in my brain, because this is what works for me, is it's an iceberg. And the little bit that sticks out over the top of the water, that's all the stuff we measure. That's, school readiness scores. That's all of the things that are easily, tabulated. Great. But that is only possible, all of those different outcomes. We could add health status outcomes up there as well. But that's only possible if we spend time on that giant chunk of the iceberg that's below the water, which are the everyday moments that build that scaffolding and that foundation, those safe, stable, nurturing moments that children have with adults who love them that allow us to get to that point at the top of the iceberg. So we can't talk only about this. We got to think about all the ways that we create those preventative moments of strength that allow us to kind of see those outcomes. So it's exciting and it's doable.
It is exciting and it is doable. So I need to know, and our members need to know as well, how can our members start Reach Out and Read in their centers?
Absolutely. So the best way to do that is to simply contact Reach Out and Read. You get the benefit of that organization support that I mentioned before from the very beginning. Our website is reachoutandread.org, and there's information on that very first page about how to start a program, and that will put you in touch with the right Reach Out and Read person who is in your state or in your space. And then that organization person and sort of system is going to be with you the whole way. There's an application process where we get to know more about the practice and more about, the families that are cared for there and the providers who are there. And, the beautiful thing about Reach Out and Read is that we are designed to work anywhere children and families are in the first 5 years. So we can work in lots of spaces, lots of different kinds of clinical settings. We know how to do the work in all those spaces. So jump online, get in touch with the person that's in your local area. If you're in Maryland down through South Carolina, that's me. If you're in another part of the country, it'll be another, one of my colleagues. And then we'll help you from an application phase and then into a training phase where all of our providers are getting trained. We'll make sure that your entire clinical staff is onboarded. The entire office staff understand that everyone in the clinic has a role to play and making Reach Out and Read a successful part of practice change there. And then we work together in an ongoing way from there on.
Thank you so much for providing that and for sharing that with us. So our members can get started if they haven't already. We understand that you already partner with some of our health centers, so that's great. We're hoping that those partnerships continue and expand. And I have one final question for you. Could you tell me a day in the life or what would happen during the perfect workday for you and why?
Oh, that's such a great question. Well, I think that the perfect workday for me would be a blend of both that model and that organization that I described earlier. So I have the tremendous, what Reach Out and Read says that, one of the most important things in the lives of children and families are relationships. And that's true for the children and families that we're serving. But I always tell my team, every relationship between me as a staff member and that family matters just as much. So the relationship that I have with my amazing team of individuals that support the implementation of Reach Out and Read from Maryland down through South Carolina, working with those amazing people and nurturing the relationships that we have together is absolutely a part of my perfect day. Getting ready and having the opportunity to build the strategy and work together with those amazing individuals inside my organization and our community partners outside the organization to figure out how we continue to grow and scale Reach Out and Read would always be a part of a dream day. And then also being able to share that story with the many funders and stakeholders and policymakers and all the people that help us ensure that work sustains would also be a critical part of that dream day. And then finally, the opportunity to be in a clinic and share a little bit of that experience with our clinician partners, watch a child leave that exam room with a book in their hand, excited to take it home and read it for their bedtime story. I couldn't ask for a better day.
I love it. Well, is there anything else that you haven't been able to share with us?
I think that really just hear me say that Reach Out and Read is deeply committed as an organization to ensuring that this model does become a reality for all children and families. And we're working very hard at that scale across our entire country. And we look forward to working with all of you in that process. So thank you in advance for your partnership.
And we thank you, Callee, for being here and for joining us today.
It's my pleasure.
I would like to thank Callee for joining us today, and thank you to all of our listeners for tuning in to the Common Health podcast, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you would like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.vcha.org.